Welcome back to AI Insights Live, the show where we cut past the hype, but we go deep on what's real in AI for your business and for mission critical enterprises. And we help you lead confidently in a world that's changing fast. I'm Andres, the founder and Chief Technology Strategist at Zeroday Cybersecurity. Today, we're focused on a topic that sits at the intersection of two deeply important domains: healthcare and tribal governance. If you're leading a clinic, a tribal health program, or a public health initiative in an Indian on a reservation, you're simply trying to implement AI responsibly in a highly regulated setting. This one is for you. Here's the critical AI question of the day: who really owns the data when AI systems enter the clinic or the tribal council chamber? The question may sound simple, but it is loaded with implications. Because if you don't own or at least govern your data, then you don't have sovereignty or a competitive advantage. You may have exposure. Here's the interactive hook that could really help for all of us here. So, for those of us that are on here live, if you're from a clinic or a healthcare system background, I want you to type clinic in the chat. If you're representing a nation or a healthcare authority, a tribal health authority, I want you to put native-led program. Go ahead and type in tribe as well. I want to see who's out there who really cares about this information, because sometimes they overlap, yet strategic challenges could really be the same. So, what are we going to talk about during this episode? Well, we're going to dive into how AI is being adopted in healthcare settings and what unique risks that a population that is indigenous or tribal, what tribal digital sovereignty means in the age of AI, and why it matters for a health equity leader. The governance framework, the zero-day principles that you must consider, and the actions, steps that you need. A current news spotlight with real-world implications for your budget, procurement, and your risk portfolio, as well as a Q&A where you can take actionable takeaways, as well as a next step playlist. So let's get started. The first strategic zero-day deep dive: the new digital trust compact. When it comes to integrated AI into healthcare or tribal governance, the game isn't just about selecting the right algorithm or the right model. The real game is about trust. And trust in those sectors is rooted not in technology alone, but in ownership, governance, data control, and sovereignty. So, why does digital trust matter? Well, in a standard enterprise setting, you might talk about data security or privacy. But in healthcare and tribal contexts, you may need to add sovereignty, identity, cultural context, continuity of care, and long-term generational value. For instance, a tribal health center may collect data that includes traditional healing practices, language indicators, family lineage, environmental exposures. That's not just for healthcare data, it's common community knowledge and heritage. A clinic may also that participates in an AI-enabled diagnostic tool that must ask, where is this data stored? Who can access it? Can it be used to train future models? Was it truly de-identifiable? Or when tribal council partners with a vendor and the contract fails to address data repatriation, tough word for me, reuse rates, model retraining, and long-term benefit sharing. In short, you can adopt AI fast, or you can adopt AI responsibly. The difference lies in governance. I call it the digital dependency. Because at Zero Day, we define a key risk being that digital dependency trap. This is a scenario where your organization becomes dependent on a vendor or platform for AI functionality. The vendor controls your data pipeline, stores your data offsite, uses your data for retraining, and locks you into a subscription or a data flow. You lose the ability to switch providers easily because your data becomes siloed, proprietary. That intellectual property the AI vendor builds from your data, benefits them first, not your community or your organization. In tribal or health systems, this trap is especially dangerous because it undermines sovereignty, community control, and trust. If your patients, clients, or community members believe that their data is being used rather than trusted, you lose legitimacy. Here's a 0 day principle of the week. Digital trust equals data sovereignty plus AI transparency. Let's dig deeper into that packet. What is data sovereignty? Well, you must retain ownership rights or a clearly defined governance rights over your community's data. You must define who can see it, how it can be used, and when it can be archived or deleted. Who benefits from these models' outcomes? In a tribal context, that may mean on premise storage inside tribal governance boundaries or a sovereign cloud under tribal control or a strong contractual clause with your vendor. In a clinical context, it might mean segmented storage, clear data sharing agreements, and verifiable de identification standards that represent patient anonymity. But it also respects your community from which the data comes. We're also going to talk about data transparency. You don't just get a black box model here thrown at you like, hey, it just works. Don't worry about it. It's magic. No, you need visibility into, hey, how does the model input data? What types of data? From where? What's the bias risk? Two, model training and validation. What populations were used for this training? Is the data representative of community, being indigenous, rural, socioeconomic, etc.? Three, access and outcome controls. Who gets to see the results? How are decisions communicated? Can you audit the model's performance over time? It's a pretty big question here. And lastly, retraining and refresh cycle. If the model evolves, do you know how your data will be used in future versions? Here's the strategic implications for your organization. Don't let speed trump sovereignty. Yes, AI offers incredible opportunities for clinics and tribal nations. We'll cover some of that in the next segment. But rushing into vendor contracts without governance framework means that you might trade short-term gains, term exposure. Define your governance baseline. Before you purchase or deploy an AI tool, ask, where's my data stored? Who has access? Can you exit the vendor and bring your data with you? Does the vendor's contract allow you to audit the system? Is there a cultural review for indigenous or tribal data to be reviewed? Three, I want you to treat your data as a strategic asset. It's not just your infrastructure anymore. For tribal nations, data is part of your heritage, your community's resilience, and the preservation of your language. For health systems, aggregated data becomes continuity of care, outcome metrics, population health. This means you can invest in secure architecture, talent, and governance frameworks, not just in mode deploy AI. I also want you to anticipate the regulatory wave. AI is increasingly under scrutiny in regulated sectors. Health agencies, public health authorities, and even tribal health systems will soon face audits or governance requirements around AI. Starting now gives you a competitive advantage. So, Andres, what's a critical question here that I can ask? Well, does your data governance architecture treat your data as a liability or as a generational asset? If you answer liability only, you're vulnerable to vendor lock-in, value extraction, and reputational risk. If you treat it as a generational asset, you position yourself as a sovereign node in a digital graph, not just a consumer. What about HIPAA and sovereignty? How do we make that work together? Well, in this segment, we'll zoom into two major regimes that you must navigate. The federal regulatory world of healthcare. For example, under the Health Insurance Portability and Accountability Act, also known as HIPAA, the sovereignty governance world of tribal nations. For many of you, you operate in spaces where both converge, making it complex, but also a strategic differentiator. HIPAA sets a national baseline for protecting PHI, also known as patient health information, covered entities, business associates, rules of use, and disclosures, security and privacy requirements. But if you're a clinic or a healthcare provider, you should already know this. Most of us are pretty familiar with the BAA nowadays. But what many of you don't realize, HIPAA was not designed for tribals' data sovereignty, nor indigenous cultural data considerations. They assume standard healthcare pathways and mainstream populations. This generates two sets of blind spots. One, cultural data blind spots. Data that pertains to your indigenous identity, ancestry, language, traditions, relational family structures may reside outside of standard health record fields. If this is fed into AI systems without appropriate context, it may risk bias or misrepresentation or misuse. Sovereignty blind spots. HIPAA doesn't replace tribal law. If your tribal health authority is operating under a tribal compact or a treaty responsibility, you must ask, is the data stored off res? Does the vendor abide by tribal governance? Can tribal law enforce jurisdiction over data usage and model outcomes? I'm sure we're not talking about this, but these are the big things. These are the things we need to think about. Well, let's talk about triple. So what the things that we're coming up with for our clients in the indigenous space. Tribal HIPAA Plus concept. At Zeroday, we recommend every tribal health system or partnership program adopt the tribal HIPAA Plus framework. The model goes beyond HIPAA's baseline by adding layers of tribal sovereignty, local consent, and culturally informed governance exit rights. Excuse me. The key components of this framework include local jurisdiction and data localization clauses. Data should be stored locally within the tribal nation's jurisdiction and under tribal controlled cloud environment. Contracts with vendors must specify that tribal law governs the data dispute framework. 2. Cultural consent and community review. Prior to using AI systems, you must involve a tribal council and data governance board in reviewing how models will apply to the community data and whether the algorithms respect cultural values. You may require a moratorium or a staged deployment for model outcomes that could impact the cultural knowledge or language of your organization, your nation. Data you know, I have a really hard time with repatriate data repatriation and benefit sharing. When tribal data is used for model training, the benefit generated, e.g., involved diagnostic accuracy, intellectual property, cost savings, that should return to your community. That can be contractually. Exit clauses that allow you to recapitalize or reclaim data associated models if the vendor relationship ends. 4. Auditability and bias monitoring. Because many AI models are trained primarily on non-Indigenous populations, you must require baseline bias testing, ongoing monitoring, and model revalidation for your community. Vendors contractually must supply metrics such as false positive, false negative rates by demographic subgroups, especially if Indigenous or rural populations are involved. 5. Cultural data governance board involvement. Set up a tribal data governance board. If you don't have one, we can help you. That has an oversight over all data and AI initiatives, monitors compliance with tribal policy, and engages with your community and reports to leadership. Here's a real world example of what we're seeing: the Cherokee Nation approach. The Cherokee Nation Health Services, CNHS, established an internal AI pilot that leverages de identified tribal data sets stored on premise under tribal governance. The model is restricted to tribal deployment, and the vendor is contractually prohibited from reusing tribal data for their customers' models. This is a strong example of aligning sovereignty and innovation. This can be reviewed over at Sandra Day O'Connor College of Law. Another example is the annual TribalNet 2024 conference. Tribal IT and health leaders emphasize that data is the new land. You have to own it, you have to protect it, you have to grow it. Why does this matter for healthcare leaders or tribal executives? From a strategic perspective, what you're building isn't an AI deployment. You're building an ecosystem of trust. When a patient from your local community enters a clinic, it gets treated using an AI system. You want them to know, yes, my data remains under my nation's control. Yes, the data model was trained with people like me. Yes, I'm not just a data point with some people or on somebody else's profit chain. When this trust exists, you unlock 3 major gains. 1, higher adoption and better outcomes. Patients are more likely to engage, share data, and comply with treatment. Feel their culture, their identity, and their sovereignty are respected. 2, they stronger grant and funding positioning. Many federal and philanthropic programs now emphasize Indigenous data sovereignty, culturally responsible AI, and community governance. Leading now positions you for a funding 3, a strategic long-term value. Data that you govern becomes a recurring asset, improving outcomes, reducing cost leak, enabling partnerships from a position of strength rather than dependence. So, what is the first question you can go ask your organization today? When an AI vendor contract ends, will you still retain control over your data and models, or will you be locked out? If you don't have that clear exit strategy or repatriation clause, you may find your community's future locked into somebody else's. So, what are we hearing around this week in AI news? Well, some of the big things that have come out is according to Native Nation Center for Tribal Policy Research, that was just published last month. It highlights that as of today, no federally recognized tribe has enacted comprehensive AI regulation laws for their nation. But the report goes further. It notes that tribal leaders are increasingly raising issues of data sovereignty, unauthorized third party model training, and in the need for governance frameworks specific to AI and indigenous populations. Why does this matter? Governance gaps equals risks. Because tribal nations lack codified AI regulation frameworks, the default becomes vendor terms, federal frameworks, and contracts developed by non indigenous providers. This means you may inadvertently subject your data and models to external governance rather than internal tribal control. First mover opportunity. Your clinic or tribal program can set that standard by creating governance frameworks now. You can position yourself as a leader in your region. Vendor procurement, funding opportunities, and partnerships will favor those who demonstrate strong AI governance. So, Andres, what are the implications of this? Well, many federal programs, for example, the Indian Health Service, IHS, or tribal set aside health grants, are beginning to include language about data sovereignty and AI governed systems. If your organization is ahead of the curve, you are more likely to win competitive funding. Also, for the 2025 Tribal Health Data Symposium in March, one of the themes was exactly this: advancing tribal data sovereignty. Discussions focus on barriers to federal data access, tribal governance over health data, and ensuring indigenous community control their own. Or at what we're seeing at these tribal IT conferences is everybody's talking about data sovereignty. This is a big deal for us. We really need to be the first ones to strike. My opinion, if you wait for somebody else to do it, they will not take into account your people's culture. It is your responsibility as a healthcare leader within a nation to define your policy. Can you change it? For sure, there will be changes. Your start today, you're going to be in a much better position as these regulations, vendor contracts come up for review. My recommendation is to convene a tribal data and AI governance task force within your clinic or your tribal healthcare authority. I want you to benchmark your current data architecture. I want you to map out where tribal and indigenous data flows, how it's stored, and who has access. Audit vendor contracts. Look for clauses like data reuse, model retraining, data ownership, exit strategies. Begin drafting an AI governance charter. Include cultural oversight, community review, local storage, audit rights, bias monitoring, and exit and repatriation clauses. If your current AI procurement or vendor contract is up for renewal, are you going to make sure that you have a clause for that data repatriation? That word it still eludes me. All right, for those of you in the chat, do you have these clauses for data sovereignty and data repatriation in those contracts for renewal? If your answer is no, I want you to say no in the chat. If you have a yes, I want to see it in the chat as well. This is a big deal. I really want to know what the tribes are doing today. So for those of you that are live with us, do we have any questions here? I'll go ahead and drop it in the chat. But here's some of the pre-submitted questions I've received from audience members. Andres, how can a small tribal clinic audit AI tool compliance without having a full data science team? It's a decent question. I like it. It's a good question. But you don't need to have a PhD. I don't. Start an audit. Here's a practical approach. You can use the NIST AI risk management framework called the RMF playbook. It was just published a couple years ago, but it is still very powerful for us. It provides a step-by-step checklist for identifying data sources, risk profiles, bias checking, access control. I want you to concentrate on 3 spot checks: data source documentation. Ask the vendor and partner up front. What data was used to train the model? Was any part of it non-Indigenous or non-rural populations? 2, performance metrics on your populations. Even if the model is generic, ask for a cohort test with your community's demographics. Are outcomes comparable? Exit and ownership rights. Review the contract around your data and model outputs. Can you move away, reclaim your data, and audit results? You can engage a third-party auditor for a one-day review, but many of these steps can be done initially internally with your executive's sponsorship, vendor cooperation, and clearly defined checklists. Next question. If tribal law overrides vendors' terms of service, how do we enforce it when a vendor is outside of tribal jurisdiction? Jurisdiction is a difficult topic because vendors are multinational, cloud-based. They might use a lot of external capabilities. I know for ourselves in Zero-Day Cyber, we don't use all our own assets because again, it's all about scalability and what's beneficial for the client. For this specific instance, you can include a governing law clause in your contract. It specifies that tribal laws govern the contract and dispute resolution is under tribal jurisdiction or a mutually agreed venue. You can use a sovereign vendor model, requiring the vendor to authenticate that they will comply with tribal governance, provide audit log, on-site inspections, and accept tribal governance board over. Find your exit. Lock it in up front. If you can't enforce tribal law in practice, then minimally you need exit rights, data repatriation, and severity clauses to protect the community if governance fails. Now, do we have any questions in the chat? Well, not as active this week, but it's no problem. No problem. We'll bring it up later. You are leaders in healthcare and tribal governance. This is your moment. The AI wave is already across all these clinics, tribal health systems, and indigenous nations. But the winners will be those who govern the wave, not just ride it. Here's your next move. I want you to conduct a sovereignty data audit. 1, map your data flows. Where is your health data stored? Who owns it? What tools access it? What AI and analyst systems feed data in or out? 2, review your vendor contracts. Draft 1 if you're about to purchase as well. Ask, what's full clarity on data ownership, repatriation, and exit rights? Is there bias monitoring for your community? Set up the audit model outcome. Does the vendor accept tribal governance jurisdiction or special clauses for indigenous data? Step 3, I want you to build and formulate that AI and data governance board, representing tribal leadership, health executives, data officers, and community voices. This board should review every AI deployment, monitor outcomes, approve vendor engagements, and report to your governing council or board. If you'd like support, well, we're here at Zero-Day Cybersecurity. We offer free checklists tailored to your regulated sector that covers key governance hotspots such as vendor login risks, data sovereignty gaps, exit strategies, and audit readiness. You can visit us at zeroday-cyber.com, or you can scan the QR code at the end of the show. Or you can reach out to us at 775-737-0329. I want you to leave with this. If you lead from a place of sovereignty, you transform risk into resilience and innovation into legacy. Thanks for joining. I'm Andres with Zero-Day Cybersecurity. You're compliant, but to lead confidently in the age of AI. See you next week.